Hi, I'm Jen Banky. I am the owner here at Thrive Integrative Psychiatry, and I'm also the medical director of our TMS program. And you are likely here because maybe you were referred by one of your medical providers, or maybe you're just curious about TMS and what it is and if it might be helpful for you. So in this video, I'm going to answer a few of our most commonly asked questions about TMS, and then I'm also going to let you know how to take the next steps toward treatment if you're interested in that. I'm going to go over our top 5 most frequently asked questions, and I'm not going to go over in a ton of detail because I don't want to bore you, and also because we'll be going over that with you at your free telephone consult as you progress in the process of getting into treatment. All right, you can also find a ton of information on our website, which is thrivetms.com. Okay, so first question we always get is, what the heck is TMS? And we do a lot to educate and build awareness around TMS because we really believe in what we're doing and the results we're seeing. TMS stands for transcranial magnetic stimulation. It's an FDA-approved non-drug treatment for depression. And it also helps with things like anxiety, PTSD, OCD, traumatic brain injury, and a few others. In TMS, a magnet is placed on the head and uses an electromagnetic field to stimulate or turn on the neurons at the surface of the brain. And then, like a domino effect, this causes the next neurons to fire and then the next neurons in the chain to fire, and it creates this kind of roadway. And this roadway reaches deep down into the areas of the brain that are not functioning optimally in depression. And with repetitive activation of this roadway and this deep area of the brain, our brain starts to rehabilitate. You can think of TMS as rehab for the brain. And we become more happy and less anxious and more relaxed and content. Okay, question number 2, is it legit? Yes, it is. It's been FDA approved now since around 2008, and there is decades now of research demonstrating that TMS is safe and effective medical treatment. Question number 3, is it safe? Yes, it is. The nice thing about TMS is it doesn't carry the same risk for systemic side effects as medication. Most folks tolerate TMS really well, and in fact, they often are sad to leave treatment when it's over, and we're sad to see them go. Question number 4, does it work? Yes, it does. Approximately 83% of patients experience a significant improvement, and around 60% experience remission, which means it goes away. And I'll be the first to tell you that TMS does not work for everyone and for everything, unfortunately. But based on some of the amazing and totally inspiring recoveries that we've witnessed in our clinic, I'm always cautiously hopeful. Okay, question number 5. Does insurance cover it? Yes, they do. There are certain criteria that need to be met, and our team has gotten really good at navigating those insurance hoops and advocating for our patients. So other common questions we get are, is there an out-of-pocket cost? What does that look like? What's the treatment schedule? What appointments are available? And the answer to those questions is really individual because it depends on your specific insurance plan, your symptoms, your schedule, and then our clinic schedule at the time of your treatment. So the best way to get those specific answers is to complete our TMS self-assessment. And this can be found on our website, thrivetms.com, or you can call us. Call the office, 503-379-0208, and we'll email you a self-assessment, or we can walk you through it over the phone. So once we receive that self-assessment, we'll give you a call, and we'll set up that free telephone consult that I mentioned. And this is where we'll go over your specific insurance benefits, any scheduling questions, and of course, any other questions you might have about TMS. So if you're thinking TMS might be a treatment option for you or for someone you know, go ahead and complete that TMS self-assessment and we'll be in touch. I sincerely hope that we get to meet you and that we get to be part of your recovery journey. Thanks for checking out this video.